So good evening, and thanks for joining us on our 6 of 6 hypertension workshops done with the Town of Windsor in partnership with the Department of Public Health through their preventative block grants. Tonight's topic is urgencies and emergencies with hypertension, and Dr. Atik Mirza is here to do that presentation. Wanted to remind you that the presentation will be done with question and answers to follow. And then there'll be a brief time for demonstration of the use of the self-monitoring blood pressure device. Also, if there are any of you who are interested in acquiring a device at home and cannot find funding to do that with your insurance company, please contact us as we can work with you to help you secure one of those. Also wanted to remind everyone to return the evaluations and the pre-diabetes screening checklist. And for each one of those that is returned, we will provide you with a $5 First Town Downtown gift card. So I wanted to encourage you all to do that, to be a part of that grant outcome information. And with that, I'm going to turn it over to Dr. Mirza.
Thank you, Jenny. And hi, everyone. How's everyone doing?
Well, thank you.
All right. So today concludes the series of lectures for this hypertension workshop. So okay, so good evening, everyone. My name is Atik Mirza. I'm a cardiologist. I have practiced in Enfield, Simsbury, and Hartford, and our practice name is Central Connecticut Cardiologist. I also teach residents, students, and fellows both at the University of Connecticut and Frank H. Netter School of Medicine, Quinnipiac University, Connecticut. I've been in practice for more than 20 years now. I will just stop it here, not go beyond that. So today's topic is hypertensive emergency and urgency. And before I start today's talk, I would like to thank again the Town of Windsor and Department of Public Health for providing the grant, and the Town of Windsor for organizing these talks to help the community to understand, learn, and do all the preventive measures for hypertension. So today what we will be doing, we will be talking about the understanding of hypertensive emergency and urgency, and how to recognize these entities of high blood pressure, and then discuss what causes the hypertensive crisis, which is another name for hypertensive emergencies and urgencies, and then at the last, how to prevent and respond to these crises. So I would like to revisit our slide which we had in our first lecture about categories of the blood pressure before we move to the hypertensive urgencies or emergencies. This gives us an overview of the different categories or the classification of the blood pressure. So normal blood pressure is less than 120, the top number, which we call systolic blood pressure, and less than 80, which is the bottom number or the diastolic blood pressure. When the blood pressure top number ranges between 120 to 129, we call it an elevated blood pressure. And still you may have bottom number or diastolic number less than 80 millimeter of mercury. When the blood pressure goes in the range of 130 to 139 millimeter of mercury, the top number, systolic blood pressure, we call it high blood pressure or stage 1 hypertension. And with this, the diastolic number ranges between 80 to 89 millimeter of mercury. Stage 2 categorize blood pressure, systolic blood pressure above 140 millimeter of mercury, and the diastolic above 90 or higher. And when the systolic blood pressure goes above 180 millimeter of mercury, and the diastolic goes above 120 millimeter of mercury, that is called hypertensive crisis, or in other words, hypertensive urgency or emergency. And we will discuss how to differentiate between these two and how to have more recognition, understanding, prevention, treatment, and how to respond. So hypertensive crisis, as I mentioned earlier, is a term used to describe severe elevation in the blood pressure, which may or may not be associated with end organ damage, which may or may not be associated with any symptoms. So what are those end organ damage, end organs in your body? Those are your eyes, your brain, your kidney, and your heart. So usually these are the organs which get damaged with severely elevated blood pressure, and you develop signs and symptoms according to the organ involved. So as I mentioned earlier, hypertensive crisis, blood pressure, systolic more than 180 millimeter of mercury, diastolic more than 120 millimeter of mercury. It can be divided into hypertensive emergency and hypertensive urgency. It is very simple to define these two categories under hypertensive crisis. Emergency means there will be an evidence of end organ damage, and mostly this is, you will have some symptoms associated with it, whereas hypertensive urgency, you will not have any end organ damage with it, and most of the time people don't have any symptoms attached to this kind of elevation of blood pressure. So hypertensive urgency, blood pressure 180 over, more than 180 over 120, without the evidence of acute end organ damage, and usually no symptoms are associated with it. I hope this makes it clear. The definition: hypertensive urgency, blood pressure more than 180 over 120 millimeter of mercury, and end organ damage are not happening, and you may not have any symptoms. What is hypertensive emergency? It's the numbers remain the same, blood pressure above 180 millimeter over 120 millimeter of mercury. But this is complicated by acute end organ dysfunction. And it is also associated with various symptoms depending on the affected end organ in your body. Symptoms will be differed accordingly depending on which organ is involved. Heart will give you different symptoms than the brain. Eyes will give you different symptoms than the kidneys. So, as you can tell, hypertensive emergency is more dangerous than the urgency. So when blood pressure rises above 180 over 120 millimeter of mercury, your brain can stop functioning. The term, I'm going to use the scientific terms, and then later on we will use the simple terms. I'm using the scientific terms so that you all understand in case you go to your healthcare provider or any of your family, friend, or anyone has been through it, or God forbid, may have to experience all these things. This will help you to understand. So hypertensive encephalopathy means patient brain is not functioning. Eclampsia is severely elevated blood pressure in a pregnant woman. Stroke means, again, part of the brain is not functioning. Blood supply has been not adequate to certain part of the area. Dissecting aneurysm. Dissecting aneurysm means that there is a tear, a large tear in the one of the biggest vessel which supply the blood to the rest of the body. Acute left ventricular failure means it's a dysfunction of the pumping power of the heart. Main pumping chamber is left ventricle. Then it can lead to pulmonary edema, which means that you start retaining fluid in the lungs because of the backlog of the blood in the lungs. Then that leads to shortness of breath. At the same time, if the blood pressure stays very high, that also can cause a heart attack and acute shutdown of your kidneys, which is called acute renal failure. Or if small vessels of any of the end organs or the body are involved, you can develop anemia, which is called microangiopathic hemolytic anemia, means that blood cells starts breaking down. So this is all fancy language for all the symptoms which can happen to you or your loved ones if the blood pressure rise above 180 over 120 millimeter of mercury. In simple words, you can see stroke, heart failure, sexual dysfunction, which I did not mention, is another, because sexual organs, which are ovaries and testicles, are another and organ in the body which can be damaged with this much high blood pressure. Kidney failure, heart attack, and vision loss, as I mentioned earlier. How prevalent in this and how much damage this condition can do to you? So there have been studies done which have found that around 1 to 2% of adults with hypertension will experience hypertensive crisis. Some people will experience symptoms and others may not. In 2018 alone, nearly 500,000 deaths in the US had hypertension as a primary or a contributing cause. 500,000 deaths in 1 year. It is a huge number. So that tells us that how important it is to recognize and treat. If we look at this graph, which breaks it down between male and females and hypertensive emergencies and urgencies. So the blue bar and the red bar are for male. Blue is for hypertensive emergency and the red is for hypertensive urgency. So if we see that in men, these are the hypertensive urgencies. And maximum of urgencies happen in the age of 51 to 60. Whereas hypertensive emergencies are less prevalent and they also happen in the age of maximum happen in 51 to 60, but slightly more in 61 to 70. Whereas if we look at females, green is the hypertensive emergency in female, whereas hypertensive urgency in female is shown by the purple. If you look at it, women at the highest risk amongst all the categories for having hypertensive urgency. The ages between 51 to 60 have up to 45 to 50% chance of developing urgency. And ages between 61 to 70 are somewhere around 25 to 30%. So women at a higher risk of developing hypertensive urgency as compared to men and as compared to developing hypertensive emergency. If we look at the emergency is still higher than the men and women, but still less as compared to the urgency. So looking at this graph, in nutshell, we can say women are at a high risk of developing urgency and emergency, both as compared to men. What are the causes of hypertensive crisis or hypertensive urgency or emergency? The one and foremost and the major cause which we have been studying over the years is non-compliance with taking blood pressure medications. Non-compliance means those who do not take in the amount the medication has been prescribed, the frequency the medication has been prescribed, or do not take the medication at all. What's next? Non-compliance with the diet and exercise. These two factors are also contribute to develop high blood pressure if you're not following these, but once you have the blood pressure, if you're not following certain diet and you're not exercising on a regular basis, chances are that you are at a higher risk of developing hypertensive crisis. Then comes the drug abuse. And amongst those drugs, cocaine, alcohol, and amphetamines. These are the drugs which usually causes hypertensive crisis. Tobacco smoke, underlying heart or vascular disease, underlying diabetes, underlying kidney disease, obesity, and being overweight. They all can contribute to the hypertensive crisis. And we have known, according to the previous graph, that urgencies are more likely to happen as compared to the emergencies, but emergencies are more damaging, more hurting, and cause very serious issues to deal with in our body as compared to urgencies. So what are the symptoms we feel? People can have severe headache or migraine-like headaches. People can feel just dizzy or muscle weakness. People can become confused starts having numbness, tingling sensations, or simple in women, which is more common, generalized severe anxiety, that the people just become anxious. Some people start nausea or vomiting. People feel changes in the vision. People become totally unresponsive. Some people present with nosebleeds. People can have seizures and fits. And last but not the least, people can have severe chest pain, which can be related to the heart attack, or shortness of breath, which can be related to your heart failure. So please remember these symptoms. If any of these happen, it means with the high blood pressure numbers, these are something we need to be concerned about. And please, yourself or someone else, if I should call 911 if someone see these symptoms with elevated blood pressure of 180, more than 180 over 120 millimeter of mercury. So we have also been studying in multiple studies that people who present to the emergency room, the most common symptom has been seen in these people with hypertensive crisis is 40% headache, 21% nausea and vomiting, 17% body weakness, which signifies stroke, chest pain, which can signify the heart attack, shortness of breath, which signifies heart failure, and loss of consciousness, which can be encephalopathy or stroke. So these are the breakdown of how commonly these symptoms can be seen during the crisis. So what should we do if we see these symptoms? So those people who are experiencing hypertensive crisis and those who do not have any symptoms, means there's no end organ damage involved, they need to recheck their blood pressure within 5 minutes. And during that 5 minutes, they need to relax, take some deep breaths, sit down in a comforting chair. If bladder is full, empty your bladder. Try to relax yourself, close your eyes, and then recheck your blood pressure. And if blood pressure reading still continues to be above 180 millimeter over 120 millimeter of mercury, then it's the time to call your doctor, go to an emergency room, or go to a walk-in center to get some immediate help, because that number is not good for your health. One thing I would also mention over here, that hypertensive urgency can change into hypertensive emergency at any moment. If we do not control the urgency, it can become emergency at any time. So do not wait because you are having no symptoms, so it's okay to wait at home. No, immediate help is required because urgency can convert to emergency. And if you have any of those symptoms with elevated numbers, blood pressure above 180 over 120 millimeter of mercury, and with all those symptoms which I described earlier, do not wait at home. Call 911 and go to the nearest emergency room as soon as possible, because the quicker you reach to a facility where they can lower your blood pressure, the better it is for you, because that will save the damage to the end organs. How do we treat these hypertension crises? Just for you, our community to know that we use intravenous blood pressure lowering medications, because oral medications will not help. We need to reduce not more than 25% of your blood pressure in the first hour. And then, because rapid decrease, if we lower your blood pressure to normal within so quickly and so little time, that can cause brain damage or ischemia of the heart or the brain, because your body has lived at a high blood pressure for some time. If we lower it so quick, your body organs may be less perfused. Once your blood pressure has been stabilized on intravenous antibiotics, then we switch you to oral antibiotics. So this is how we treat. But I have put it in a very simple, 3 bullet points for you, but actually it's not that easy as I have described in this slide. Actually, what we really do it depends what underlying condition you have. So if you have acute ischemic stroke, within 24 hours, we need to bring your blood pressure below 220 to 120. And I'm giving you a higher number here because blood pressure can be higher than 180. If you have preeclampsia, then we need to bring it below 160 or 110 in 24 hours. If you have dissection, then we have to immediately, dissection means tear in the larger artery in your heart and the body, immediately below 120, the top number. And if you have acute ischemic stroke, within 1 hour, we need to bring it. And so it's a little complicated here. And this red on the right. If you are a candidate for a clot busting medicine and having a stroke, then we need to bring it within an hour below 185 over 110 millimeter of mercury, because we cannot give you the clot busting medicine at that time. And again, if we are having some bleeding stroke, mean the high blood pressure has ruptured an artery in your brain, then we need to bring it below 140 millimeter of mercury within hours. So as I said earlier, it all depends that what is the underlying condition and what other comorbid conditions are before we decide which medication we need to give you, how quickly we need to reduce your blood pressure. And also, one thing which is not mentioned in my treat to target chart is if you have been taking any illicit drugs like cocaine or amphetamine, then again, we have to decide different kind of medications and way of lowering your blood pressure due to those drug interactions. How to prevent this? So I'm going to spend a little bit more time how to prevent it, because prevention is easier than the treating if urgency or emergency has happened. So the most important thing I mentioned earlier, the most common cause is that people not taking medications as prescribed. So prevention is please take your medications, the dosage, the frequency, whatever has been prescribed to you by your physician, take them on a regular basis. And if you travel, make sure you carry your medications with you, at least put them at 2 different places in the luggage in case you lose the luggage. In a study in 2015 found that people who often did not take their blood pressure medications were more likely to be hospitalized, developing worsening of their health issues. So it's not that you'll only go through the urgencies and the emergency of the hypertensive crisis. You may end up in the hospital due to your other comorbid conditions. It has been also seen that lifestyle changes that people can make to help lower their blood pressure are very helpful to prevent and lower the risk of developing hypertensive crisis. So it's very simple, eating a healthful diet. People try to go on different diets. Only one diet has been studied thoroughly, scientifically to prevent the cardiovascular events, that is Mediterranean diet, which is rich in fruits, vegetables, fiber, and possibly using olive oil. Cut down your salt and sodium intake because that directly lowers your blood pressure. National Heart, Lung, and Blood Institute devised a diet which is called DASH diet. It stands for Dietary Approaches to Stop Hypertension. If you use this diet, this is known diet to lower your blood pressure. This is a caloric control, heart healthy eating plan that does not require any special foods. Cutting down on alcohol and caffeine also help your blood pressure and improve your overall health. If you cut these down and you are hypertensive, chances are less that you will develop hypertensive crisis. Reduce your caffeine intake. Choose caffeine-free herbal teas over the coffee or other drinks at your leisure. So the 2020-25 guidelines for the Americans recommend that adults avoid or limit their intake of alcohol. According to these guidelines, men should consume no more than 2 drinks per day, while women should consume no more than 1 drink per day. So if we stick to these guidelines, this is going to help to not only control the blood pressure, but also to prevent the hypertensive crisis. Take care of your portion size. Do not consume any food in excess and be watchful of the portion you're consuming during one meal, because that has also been related to worsening of blood pressure control. So I've been telling my patients that you use the salad plates, get rid of the dinner plates so that you use a smaller portion. That is going to be very helpful. If any doubt about your diet, your portion size, or caloric count, always check with your dietitian or your primary care provider for the directions about what food to eat, about the servings of the food, and the quality of the food, which will help you to maintain your blood pressure control and also prevent hypertensive urgencies and emergencies, and also will help you to take a good nutritional diet. Staying physically active, getting a regular exercise not only helps your heart and circulatory system healthy, but it also helps control your weight, and that leads to your better blood pressure control. If we do not pay attention to this, this can also lead in hypertensive patients to hypertensive crisis. CDC recommends that people aim to do, all of us, unless there are some limitations or restrictions, 150 minutes of moderate aerobic activity per week, or 75 minutes of vigorous aerobic activity on a regular basis every week. As I said earlier, these recommendations can vary according to individual person, patient, because every patient have different comorbid conditions. Avoiding smoking and drugs. Smoking is one thing which raises your blood pressure, and it increases the risk of experiencing cardiovascular issues, heart attack, stroke, and if you have blood pressure, it will raise your blood pressure, and it can raise it to hypertensive urgency or emergency. People who smoke have to consider it. Please do it. For God's sake, do it. Talk to your healthcare provider. Talk to anyone who you feel comfortable who can help you to quit. And please try to quit sooner than later. It can be the biggest gift to yourself and lots of saving in your pocket if you stop smoking. As far as the drugs are concerned, they have known to cause health crisis, including hypertensive urgency and emergency. So please stay away from the drugs. This is something which most of us may not pay any attention. Having a good enough sleep at night also helps you control the blood pressure. At least every adult should aim for 7 hours of sleep each night. It improves our overall health. It helps our heart and circulatory system, and also help to control blood pressure. Those who have poor sleeps, their blood pressures are usually a problem and not under good control. What helps to get enough sleep is having a physical activity during the daytime, getting plenty of physical activity. That will help you to have a good night's sleep. Having a regular hours of going to bed and waking up in the morning also provides good sleep hygiene. Ensuring sleep environment is comfortable for you, which is cool, dark, comfortable, and free of noise and distractions. And nowadays, the biggest distraction is our cell phones. So if we follow these guidelines, observe these sleep hygiene, I think that will also help to improve blood pressure control and prevent the hypertensive crisis. So let's go over what we have discussed in the last half an hour and summarize it. So in summary, we can say hypertensive crisis occurs when blood pressure rises to an unusually high level of 180 over 120 millimeter of mercury or higher. That can be with symptoms or without symptoms. A person having hypertensive crisis with symptoms will have hypertensive emergency, and the person who, without having symptoms involving end organ damage, will have hypertensive urgency. Factors that can give rise to hypertensive crisis include not taking antihypertensive medications, having interaction between certain medications you take, and use of illegal drugs. Certain underlying health conditions can also trigger the hypertensive crisis. That's why it's very important to follow up with your doctor, your primary care provider, so that your other comorbid conditions can be put in check and be treated so that they don't interfere with your high blood pressure to develop hypertensive urgency or emergency. But as we mentioned earlier, there are some steps a person can take to lower their blood pressure and reduce the risk of experiencing hypertensive crisis. These steps include following a healthful diet, reducing alcohol intake, avoiding drugs, quitting smoking. Anyone who would like to further advice regarding this, how to lower the blood pressure, how to maintain the blood pressure, how to avoid hypertensive urgencies and emergencies, I will highly recommend to please talk to your healthcare provider, set up an appointment, and become knowledgeable about this issue so that you can prevent the comorbidity and all the problems associated with it. Thank you very much. Again, always please see your doctor, ask questions, take your medications to all your visits, so that your doctor knows which medications you're taking, and if your blood pressure is not controlled, he or she will be able to adjust your medications for a better blood pressure control. Thank you very much. I appreciate your time, and I'll be happy to answer if you have any questions.
All right. As you all know, at the end of each of our workshops, we've done a demonstration on how to use the blood pressure self-monitoring device. You'll remember that when you get up in the morning, you should use the bathroom, and then you'll want to kind of remove any heavy clothing so that the cuff is directly on your skin. Remember to be patient. It takes a little bit of practice to get the cuff on correctly. You'll want to find a place that you can relax, and also a place where you can rest your arm at about the level of your heart. The tubing should come out the bottom, what we call the antecubital space, kind of centered there. Let me just see, I'm having my own little challenges here. Here we go. So again, that tubing is right there, that the cuff is nice and tight. You'll want to turn on the device with the button. Some of the devices come that they can record 1 or 2 people's readings. So make sure you get that set on person 1 or person 2. And then, as I always have to remind myself, we're to be quiet while you're taking your blood pressure. The important thing to also remember, Dr. Mirza mentioned this during his presentation, if you got a reading that is atypical or unusual for you, take a minute. You might need to get up and use the bathroom again, and then sit down and take it again, but let a little bit of time span. If you take your pressure too quickly, one after the other, you can get some false high readings. So again, giving it a little bit of time before you repeat that reading. Any questions about that?
That is a good point, to not just take it immediately thereafter. It would cause false highs because,
Because, first of all, you might have a little bit of anxiety. Second of all, when we use that cuff, we're restricting blood flow. So we're really closing the vessel. And then as the cuff loosens, it allows the blood to flow through. So you're taking that first reading. And then when the vessel is completely expanded, we get the second reading. And so when you're doing it too fast or too close, it can give that false high because of the constriction of the vessel.
that makes sense.
Yeah.
Thank you.
Well, you are welcome. Also wanted to kind of just highlight the educational materials that we have for you based on the information that's been presented at the workshops. So all of the handouts that the speakers have reviewed are included in a folder, as well as all of the evaluations that I've mentioned a few times. Those evaluations are also available online and can be completed online and then submitted to the Windsor Health Department. I think we've also talked about, and has mentioned again, the importance of medication management. And so we do have, I'm just going to figure out how to open this, a pill sorter for you to help organize your medication. So the pill sorter looks like this, and then we have rainbow days so that each day you can take your medication out and then organize by morning, noon, evening, and bedtime. And you could easily take this and travel with it, or if you were going for the day, or travel with the whole case if you were leaving for the week. I think, as Dr. Mirza mentioned, make sure when you travel that you have a couple of sets taken with you so that if your luggage was ever lost, you also would have a set of medications on you in your purse or any kind of carry-on luggage. All right, let's see. We also have a water bottle in here, reminding everyone to be healthy and nutritious. And we have a Kinsa thermometer. So these are also included, not really having to do with hypertension, but more health and wellness in terms of monitoring temperatures in light of the pandemic and the COVID virus that's been spreading. All right. So again, I just encourage you all to return the information so that we can award those gift cards, First Town Downtown, and feel free to answer any questions that you might have. And we'll sign off for now. Thank you for joining us. Bye-bye.